If you don't have 20/20 vision, you can use many different methods to improve your eyesight. Wearing contact lenses is one of them. Contact lenses help people see better without affecting their appearance or interfering with activities. But wearing them entails responsibility. Poor hygiene and bad habits can lead to infection and even loss of vision. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk on CNN Philippines. We're here to build a healthier future for you. August is Eyesight Month. Let's observe it by making sure we take proper care of our eyes. To help us with today's discussion, let's welcome Dr. Victor Efrain Paulino. He's a comprehensive ophthalmologist and glaucoma specialist from the Makati Medical Center. Also with us is Dr. Janina Bianca Ortiz. She's an emergency medicine specialist from the Veterans Memorial and Medical Center. Now, learning how to properly clean or handle your contact lenses is important to keep your eyes safe and healthy, but caring for it will depend on the type of lenses you have. I'll start first with Dr. Binky. Gaano ka-importante ang tamang pag-handle at paglinis ng mga contact lenses? I know a lot of our viewers here are using contact lenses now as opposed to wearing regular glasses.
We have to assume na our hands are always dirty. Madumi siya palagi. So in this time of COVID lalo, we can transmit the virus to our eyes, our nose, and our mouths. So hygiene is basically the core of safe contact lens use. We have to make sure that our hands are clean and dry. We wash our hands and dry them thoroughly before and after we put on our contact lenses. And also kapag tatanggalin natin yung lenses natin.
There are two general categories of contact lenses, soft as well as the hard, which can be also called rigid gas permeable. Now, soft contacts are the most popular type of lenses. They're more comfortable than hard contacts since they hold more water and they really don't touch the cornea per se. There are several types of soft contacts. Dr. Rem, please tell us what these are because a lot of people may no longer be aware na meron pa ring hard contact lenses, but between the soft and the hard, they depend on the person actually using it. There's one that is suited for a certain type of person. Is that correct, Dr. Rem?
Yes, that's correct. So between the hard and the soft contact lens, hard contact lens usually provides clearer vision. The problem is you have to understand that the contact lens is just gliding over the cornea. So with respect to the hard contact lens, those are the gas permeable contact lenses. So they are more suitable for patients with diseases of the cornea like keratoconus. And then for the more common soft contact lenses that most of the public wears, they can range from correcting farsightedness, nearsightedness, astigmatism, and even presbyopia.
And one type of soft contacts is the extended wear lenses. They're available for overnight or continuous wear, ranging from around 1 to 6 nights or up to even 30 days. Dr. Binky, waking up with clear vision sounds very tempting for a lot of people who wear contact lenses, but is this the way to go?
Actually, experts advise na even if you have extended wear lenses, let your eyes rest. Actually, your eyes needs to rest. And they also need oxygen. The problem is, when you wear a contact lens, it forms a barrier on your cornea or the clear part of your eye where your contact lens rests, reducing the amount of oxygen that can get into your eye. This causes your eyes to get dry, irritated, itchy, or sometimes a bit swollen. And of course, when this happens, the chances of getting an infection gets higher.
Let's talk about the cornea of the eye, what it's really for, what the function of it is, and what could happen in case it is injured by improper handling of contact lenses, or what type of injuries can they sustain?
We have to understand that the cornea is an optically clear organ. So it's technically as crystal clear. So and then the contact lens over the cornea, we have the tear film. So the contact lens glides through that tear film. So dumudulas lang yung contact lens doon. In cases where we sometimes have accidents with our contact lens, we can encounter some abrasions. So nagkakaroon ng gasgas dun sa cornea. And then that abrasion can lead sometimes to ulceration, to infection, and hopefully hindi naman umabot. But in rare cases, infection can lead to blindness.
Now let's talk about hard contacts. These are more durable actually than soft contact lenses, and they tend to be less expensive than soft contact lenses since they last longer and are less likely to tear. Dr. Rem, who are the ideal people to be wearing hard contact lenses?
Hard contact lenses are more advised to people with corneal diseases talaga like keratoconus, wherein the contour of the cornea is irregular. So we have to understand that the hard contact lens conforms shape to the cornea. Sometimes kasi hindi masyadong smooth yung corneal surface. So the hardness of the lens makes I have a model eye, so if the contour of the lens is irregular, the hard contact lens acts as a parang it conforms the regularity to the cornea. So that's why it's hard. It has to be hard in order to provide that regularity for the cornea, for the eyes to see better.
I want to talk to Dr. Binky about contact lenses that are used to enhance someone's appearance and mainly its color, because we see a lot of celebrities or maybe influencers wearing colored contact lenses, and it can change your eye color and instantly change your look. But what's your opinion on this? Do the risk justify the use of these colored contact lenses? What do you think?
We have to remember that contact lenses are medical devices. They are not just for vanity. So we have to make sure if we're going to use contact lenses, we have been assessed by a physician properly, an ophthalmologist, and we get them from licensed, authorized shops.
Now, while contact lenses provide many vision benefits, they're not risk-free. We'll talk about the common lens problems when we return. We're your connection to healthcare. You're watching MedTalk Health Talk on CNN Philippines. Contact lenses help people improve their vision and make life easier. But if you're not careful, they can cause eye problems. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk on CNN Philippines. We're together in keeping you healthy. Using contact lenses safely may take some effort, and it's easy to skip cleaning them or fall asleep while wearing them. And both can cause a lot of problems. Dr. Rem, what are some of the more common contact lens problems that you see in your practice?
Madalas naming na-encounter yung naiiwan, nakakatulugan yung contact lens over the eye. Sometimes napupunit yung contact lens. And then sometimes natanggal na pala, nahulog na yung contact lens, and the patient keeps on trying to remove it. So that leaves abrasion, gas, and sometimes leads to infection.
Dr. Binky, how does one feel when their lenses have any imperfections already, having cracks or having tears? And what should one do when this happens?
The first thing they have to do is, before putting them on, they have to check the integrity of the lens. For soft contact lenses, sometimes deformed na siya, iba na yung shape, or may punit pala. So if that happens, you have to throw your contact lens away and then just get a new pair. If nagasgas na yung eyes mo, you take your contact lens out and then just use your glasses for a while until you get yourself checked by an ophthalmologist.
Okay. Now, Dr. Rem, pwede bang magkaroon ng overuse of contact lenses? Pwede bang ang isang tao who finds contact lenses just the more ideal thing to wear, it's more convenient, but can they actually overuse the wearing of contact lenses?
The use of contact lens should be for responsible individuals only. And then the contact lens is just a substitute for prescription glasses or spectacles. So especially for the dailies, yung pang isang araw lang na gamit yung disposable contact lens, my threshold for that is just 8 hours.
So, for someone who is wearing contact lenses and nagkaroon ng alikabok sa mata, naging makatim, nagkakaroon na ng burning sensation na because it's irritated, what should they do? What's the first aid for that?
So the first aid for that is, number one, hand washing, and then they should take off their contact lenses. If they see na damage na kay contact lenses nila, they should throw it away. Kung may mga nakita silang dust or parang small pebble sa eyes nila, what they can do is they shouldn't rub their eyes. They can try to irrigate it with drops, or parang they can use parang bottled water, and then clean bottled water, and then pour it on their eyes until they can take it off. Pero kung persistent, or yun nga, nagluluha, may nana, or nagbabago na yung vision nila, that's an emergency. They have to go to the hospital.
Dr. Rem, gaano ba ka-importante ang annual eye checkup? Because a lot of people don't even realize that they need this type of checkup at least once a year.
It's called annual physical exam, not just for the body but for the eyes, because sometimes our refraction changes, yung grado ng mata natin nagbabago, especially for 40 years old, 50 years old, or more so for senior citizens. That's the time that other diseases sets in. So not just for the cornea, but for the lens, for the retina. So very important talaga yung annual eye check-up.
Now, Dr. Binky naman, there are several factors that determine how often you need an eye exam, such as what was mentioned earlier, your age, your health, and any risk for developing certain eye problems. Is this an important factor that physicians should understand, and what our viewers should take note of as well?
When we do annual exams, actually, we have to admit, nakakalimutan talaga yung mata. And given na ang raming tao na naka-eyeglasses, and then they will come to our emergency room complaining na mali na yata yung grade ng mata nila, they're developing headaches, or they're noticing na parang may mga floaters or parang parang maliliit na worm-like structures na lumulutang-lutang. We advise them that they need to consult an ophthalmologist, especially yung mga patients who are hypertensive, diabetic. Yes, they get their annual blood test. Yes, they go to their endocrinologist yearly, but they always forget to go to their ophthalmologist.
Now, Dr. Rem, during an eye exam, of course, a doctor, such an ophthalmologist, first asks about someone's medical condition, medical history, as well as their vision history. What are some of the more common things that are seen in an annual eye exam by an eye expert such as yourself that is often missed by people and they don't even realize that they have it?
Well, number one, sometimes merong mga maliliit na grade yung pasyente na kaya nakaka-experience siya sometimes ng headache, ng pagkahilo. And then also, especially for our senior citizens, may mga nagsisimula ng cataract. And then for the diabetics, one manifestation is diabetic retinopathy na nakikita lang through an eye examination. And one of the more difficult situation is glaucoma. Sometimes kasi it's a very silent condition. So yun yung mga delikadong eye condition that only thorough eye examination can diagnose.
Now, once again, improper wear of contact lenses comes with risks. If properly taken care of, your lenses should feel comfortable and allow you to see well. More on this when we come back. Your health is our mission. This is MedTalk Health Talk on CNN Philippines. The eyes are one of the most sensitive organs of the body, and all the more reason that we should take extra care with them. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care comes first. After a long day, you sometimes just want to rest and close your eyes. But if you wear contacts, wearing them too long is not necessarily a good thing. Dr. Rem, how long is it advised to wear contact lenses?
There are different types of contact lenses. So for the dailies, advisably, you have to wear it for just 8 hours or while you are outside your house. The moment you return home, you have to remove it and change with your glasses. For the type of contact lens that are for extended use, sometimes you can use it even for weeks, up to 1 week. And then there are a different kind of contact lens that you can wear for months.
Okay, Dr. Rem, pero ano yung pinaka-grabbing risk that they are looking at if they wear their contact lenses longer than what is advised?
Dikit yung contact lens sa cornea. It's because nawawala yung tears that is helping the contact lens glide the cornea. So it will really cause abrasion and discomfort.
And talking about abrasions, Dr. Rem, can injury sustained from contact lenses be so bad that a person's vision can be at risk?
Yes, the abrasions can lead to infection, it can lead to ulceration, it can lead to corneal scarring, and it can lead to blindness.
But in the ER setting, what are some of the more common emergencies wherein someone's vision is compromised?
Usually what we see in the ER are those chemical splashes. Nangyayari to usually when they clean sa home, yung gumagamit ng bleach or sometimes muriatic acid or sometimes yung mga pang-clean ng mga oven, ganon. Yung mga people who come in for chemical burns, we irrigate their eyes thoroughly with sterile water. Sometimes 1 to 2 liters kami before they say na nabawasan na yung pain. And after nun, that is when we refer them to the ophthalmologist.
Okay, is there any other way or advice that you could give our viewers on the proper use of contact lenses? Let's start first. Of course, we started with washing our hands thoroughly, but is there a proper way to actually place the contact lens on top of the cornea?
You can put your contact lens at the tip of your index finger and then pull down using the same hand with your other finger, pull down the lower lid, and then using your other hand, you can pull the upper lid up and then look up and then shoot mo na lang sa gitna. It takes a lot of practice. Hindi siya nakukuha, especially for beginners.
Is it normal, Dr. Rem, to feel uncomfortable if it's your first time to wear contact lenses? Does this sensation go away?
Yes. Remember that contact lens is still foreign to your eye. So, ang pakiramdam mo sa simula, lalo na sa simula, parang may puwing palagi. Pero, over the course of days, you'll get used to that sensation and eventually it's like you're not wearing anything.
Another question, Dr. Rem, is kung anong grado meron sa regular eyeglasses, pwede rin bang makahanap ng contact lens that is suitable as well?
Well, there's a big range from 0, yun yung mga aesthetic contact lens natin, up to the highest limit that we can have for astigmatism, for nearsightedness, or for farsightedness. Sometimes nga, mas comfortable pa yung pasyente using the contact lens than wearing yung mga makakapal na salamin.
Then before we go, Dr. Binky, do you have any tips for our viewers when it comes to eye care in general?
So I think the best tip that I can give is make sure that your glasses are always updated. And if you have any problems, you have to go to the ophthalmologist and then get your annual eye exams to prevent any problem, especially as you get older.
And with that, I'd like to thank them, ophthalmologist Dr. Victor Efrain Paulino and emergency medicine specialist Dr. Janina Bianca Ortiz. We appreciate your time here on the show and we hope that we see you again. Wearing contact lenses can make your life easier, but not if you can't handle them properly. Adding extra steps to your routine to care for your lenses goes a very long way. And soon enough, they'll feel like second nature to you. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines.